Food-drug interaction. We divide into two parts. The part 1, types of drug-nutrient food interaction. A drug-nutrient interaction is considered to be one which results from a physical, chemical, physiological, or pathophysiological relationship between a drug and a nutrient present in a food, including an enteral or parenteral feed or a supplement. Drug-nutrient interaction may result in an alteration of the kinetic or dynamic profile of a drug or a nutrient. The magnitude of change determines whether the interaction is clinically significant and require intervention. So, type of drug-nutrient interaction can be divided into 4. Type 1, Type 2, Type 3, and Type 4. Type 1, ex vivo bioinactivation. Interaction between drug and nutritional element or formulation can cause biochemical or physical reaction. Active ingredient can be deactivated before being absorbed. So this is type 1. Example, hydrolysis take place when the interacting agents are in direct physical contact, occur before the nutrient or drug enter the body, and the interaction take place outside the body. This is the example of hydrolysis. Physical incompatibility. The resultant biophysical change as the result of the interaction. So, we do not rely on visual inspection to determine compatibility among intravenously administered product. So, we use published reference. Parenteral formula. Approach to minimize type 1 drug-nutrient interaction. First, do not mix drug directly with parenteral formulas. And we also can use Y-site for the administration. Enteral feeding. Approach to minimize type 1 drug-nutrient interaction. First, do not mix drug directly with enteral formula. And we also can hold enteral feeding before administering drugs through enteral feeding tube. Third, flush tubing with water before and after drug administration. We also can use pre-formulated oral solution, elixir or suspension instead of crushing tablet when administering drug through enteral feeding tube to increase dose accuracy and also minimize clogging. Type 2, interaction or absorption interaction. Interaction affect absorption phase. So, affect drug and nutrient delivered only by mouth or via enteral delivery device. Cause either an increase or decrease of oral bioavailability of the object agent. You already understand what is oral bioavailability. Can be divided into 3 subtypes. Pre-systemic metabolism. Look at the word pre-systemic. Second, pre-systemic transport and pre-systemic binding or complexation. Interaction affecting absorption phase. The precipitant agent may modify the function of an enzyme or a transport mechanism that is responsible for the biotransformation or transport of the object agent before reaching systemic circulation. Okay. Pre-systemic binding complexation occur in the gastrointestinal tract and impair the object agent from being absorbed. You can refer from the note below the definition of object agent and precipitant agent. Type 3, interaction affecting systemic or physiologic disposition occur after the drug or the nutritional element has been absorbed from the gastrointestinal tract and entered into the systemic circulation. Example, changes at tissue distribution, protein binding. Most drugs are loosely bound to plasma protein. So displacement from binding site will increase the free or unbound drug. Type 4, interaction affecting the elimination or clearance. May involve the modulation, antagonism, or impairment of renal or enterohepatic elimination. Interfere with drug metabolism. Metabolizing enzyme present in the intestine and in the liver. Inhibition of enzyme activity will lead to accumulation of drug in the body. So example, grapefruit juice inhibit the metabolism of drug such as warfarin.